Good evening. My name is Ryan Sullivan, and I'll be presenting the Jackson Township Fire Department Community Paramedic or MIH program presentation for EMS 4308. Thank you for your time. The overview of the target population for Jackson Township is it's 37 square miles, has about a population of 43,000. During the day, that increased to 100,000 due to businesses. Our population is about 22% over the age of 65. We do have multiple nursing homes throughout our jurisdiction, and the median household income is about $89,000, which is about 20,000 more than Stark County as a whole. Our priority health needs identified through the community health needs assessment is access to health care, addiction, infant mortality and maternal health, mental health, obesity, and healthy lifestyle choices. We will be going over some of these as our goals for our program. This is a slide I wanted to put in. I thought it was very good. It mostly has to do with social determinants of health. And a lot of the goals that we're going to talk about have to do with social determinants of health. I think we've identified through our trying to start our program that a lot of the things are very basic that we can do to help people instead of doing a lot of things like medication management and transportation and simple little things to help our call volume, but also reduce the number of people going to the hospital. Goal number one for us is to increase access to healthcare services for residents. Through implementing this community paramedicine service, all our non-medical, non-emergency medical calls and health assessments can be done in the patient's home, whether that's through a 911 call that gets downgraded or a pre-scheduled type appointment. We also want to start collaborating with local primary care physicians because we do have a lot of physicians in our coverage area that we can partner with, and those patients usually live within our jurisdiction. And then lastly, we just want to, this is kind of the small little low-hanging fruit, is health education outreach programs. We already do CPR classes, but we want to expand that out to how do we do healthy living, how do we have preventative care, what available resources are for us in the county, and then use social media and in-person events, online events, just to make it educational and fun. Goal number two is to reduce unnecessary emergency department visits and hospital readmissions. The main idea here is that most of our patients don't need to go to the hospital. Even the hospital has shown that 51% of our patients do not get admitted to the hospital, they get discharged. So how can we prevent the majority of those, that 51%, by staying home or sending them to a different location or getting them in connection with a resource? So a couple things we can do with not only non-emergency or unnecessary emergency department visits, but also hospital readmission is follow-up care, medication management, going over their medications they're discharged with, their discharge plans, and then also an option here is to do telehealth services. Pulsera is a free program that I've been looking at that we could potentially utilize for patients who we don't need to be seen in an emergency department, that an emergency physician can see, and then they can direct the patient on what they should do from there. Also, we can do comprehensive assessments and develop individualized care for these patients. Most of these things are done by the hospital when they get admitted to the hospital, but when they get discharged from the hospital, it's just a matter of reminding them about their health issues and preventative emergencies to make sure that they don't end up back to the hospital. And then last but not least is overall preventative health services, health screenings, vaccinations, chronic disease management. A lot of these things escalate to emergencies, but we want to get ahead of that, obviously. Our third goal is to improve health outcomes and quality of life for residents. So providing chronic disease management and lifestyle modification programs for diabetes, hypertension, and other chronic conditions. We offer home safety assessments, and a little bit we're starting to get into fall prevention programs for seniors to reduce our risk. We do have a significant percentage of patients who fall not only in nursing homes, but also in their own homes. So these two things would be very helpful for the patients, especially if we're already there putting in smoke detectors. And then the last thing is to collaborate with community organizations, which we currently do with Access Health of Stark County, to address those social determinants of that slide that we previously looked at. Of course, we can't have a program without funding. So we would look at federal, state, and local grants. Currently, we're looking at a grant through the state of Ohio that would assist us with looking at substance abuse and mental health, and just look at research funding, opportunities, and then look at eligibility for that grant. Will it work for us? Will it hit our target population? Will it work within our geographical area? And then what are the project outcomes for this? Because obviously we want to know when we start and if it's going to work moving forward. Also with program funding, we want to engage stakeholders and partners. This includes healthcare providers, emergency service agencies, community organizations, and government officials to garner support for our grant proposals, but also have sustainability and scalability to make sure that this is significant and continues to be available for years on end. The thing that was identified is a lot of organizations that we've talked to say they usually start by funding themselves. So that's a municipal budget. We're a township government, so we would have to go to our supervisors and then give them what's the value of this program. And we're currently looking at data to garner support. So reducing healthcare costs, looking at health outcomes, and then our overall well-being for Jackson Township. This goes along with community stakeholders, healthcare providers, showing them the value of the program, and then advocating for specific budget allocation. And then once again, I highlighted evidence-based data, so testimonials, success stories, and what's the program effectiveness? What are we projecting to happen to them, to this program especially? And then establish mechanisms for monitoring and evaluating the impact of our program. So health outcomes, healthcare utilization, and cost savings. So our projected outcomes, our goal number one is to increase access to healthcare services. This is the number one thing that the Stark County Community Health Needs Assessment has identified, and this is something that we often run into, that many of our patients go to the emergency department because they don't have a primary care physician or they can't get there. So our projected outcome is a 20% increase in primary care utilization over the first year of our program. So how are we going to track it? So we're going to look at surveys with our patients, our health records, appointment records, talking to PCPs in our jurisdiction, and then billing data through health services, insurance companies. How can we collaborate? Because I do work for a current company that insurance companies, they pay directly to a third party that pays as a community paramedic to go out and see patients from a primary care perspective. Also, what goes along with this is patient feedback. So we want feedback from the patients to say, do you like this? Do you not like this? I'll say in the other job that I work at that we do primary care in people's homes, they love it. They don't have to go to the emergency department. They don't have to go see the doctor. They can have all those things provided in their home. And it just makes things healthier for the patient, and they're obviously happier also with that. We can look at healthcare provider reports if the patients do go to the office, community health assessments, so partnering with our county resources to say, hey, we're making an impact and access to care. And then last but not least, which is somewhat of a stretch, is what is health insurance saying about this? Are we saving them money? And then eventually, hopefully they'll see the value in our program and they would potentially submit funding for it also. My second goal is to reduce unnecessary ED visits and hospital readmissions. We already kind of hit on this with one of our goals, but 30% decrease in non-emergency ED visits and 15% reduction in hospital readmissions. Currently, hospitals already look at hospital readmission rates, but obviously we're in the field, we're already out here, and we can assist with that if we know what's going on with the patient through CliniSync, which is a program that connects hospitals and PCP providers. So there's room to improve there. And then also decreasing non-emergent ED visits. And I think through looking at patient records from before, but also saying, hey, you can go to your PCP for this, or we can get you connection with the PCP, or there's multiple different avenues in order to help this patient with the common cold to get potentially some prescriptions or offer them a different avenue to take care of themselves. So we can track this through emergency department records, hospital admissions and readmission data. It's already pretty much made already. Electronic health records, and then discharge planning data. How are these patients being discharged? How can we assist them with educating these residents when they're discharged from the hospital? The third goal is to improve health outcomes for residents, because this is really the goal, the main goal of the whole program. So the projected outcome is 25% improvement in diabetes management and 20% decrease in falls-related injuries among seniors within 3 years. And the idea behind this is that diabetes and fall injuries are one of the two main calls that we get called on, especially fall injuries. So I think these are, like I mentioned before, low-hanging fruit, and we can make a significant change in these types of matters, especially in chronic disease management, but also how are people falling, what can we do to help prevent that. So we would track this through medical health records like CliniSync, like I mentioned already. Patients' A1Cs, people can get A1C monitors over the counter in a roundabout way, but also many institutions have these A1C monitors. Diabetes management programs, so can help patients with getting the programs, hearing more about diabetes, how can I stay healthier with type 1 and type 2 diabetes. And then last but not least is incorporating data from community health assessments to understand baseline levels of diabetes management among seniors and track improvements over time. And then obviously with fall injuries, we would do the same, tracking the data from our end, but also the hospital end, and then also going out and installing equipment if need be for patients. Hand grab rails, how do I use a walker or a cane, watching out for rugs, simple basic things like that. And this is my last slide other than my references that can be seen on the next slide. But I think with any program, it should have a position statement or a mission statement. So this one is what I came up with. The Jackson Township Fire Department's Community Paramedicine Program is committed to providing comprehensive and compassionate care to our community members. Through innovative initiatives and dedicated personnel, we strive to enhance access to healthcare services, promote wellness, and improve overall health outcomes. Together, we are dedicated to delivering exceptional care, empowering individuals to lead healthier lives, and fostering a safer and more resilient community. I thank you for your time. I hope you all have a wonderful day, and I hope I'll report back in the next few years with a full-blown MIH program. Thank you for your time.